high because 50% of my OPD is of infertility. You can imagine. So daily I am seeing 8 to 10 patients. If I am seeing, for example, if I am seeing 50 patients in gynae patient, so already I mean 10 to 15% I am seeing fibroid. It's quite high. Moreover, incidence is increased. Why? Just because maybe because of the some genetic factor, or maybe because nowadays people they don't plan pregnancy as early, because earlier pregnancy they used to plan, all girls they used to get married at 18 or 20 years, early marriage and early conception. Now everybody is career oriented. They first finish their career, then they go for the pregnancy checker and they plan pregnancy. So moreover, that thing is late because already they come to us after 30s, 30, 35 years. At that time, we see so many patients complaining of the pain in abdomen or asymptomatic fibroid. They don't have any complaint, but still they are having large fibroids. So quite a number, 10 to 15% patients I am seeing in my OPD of case of fibroid. It depends from patient to patient, as I told you earlier. If patient comes to us as a case of infertility, already she is more than 30 years. So we just advise for certain other tests also. Okay, because already her ovarian reserve is good or not, or whether she plans pregnancy as early as possible, or she wants to prolong pregnancy, she just want to wait for a year or two. So depending on the size and site, both are important, because if size is not very much, if already size is 3 centimeter, 2 centimeter, but she is having 2-3 intramural fibroids, and there is not much problems, and we counsel her, and if surgery is not required in such cases, she can move normally. If she plans pregnancy, well and good. Even then, we advise non-hormonal treatment, because if we advise hormonal treatment, naturally, first thing is this: patient asks her, is there any side effect of the hormonal treatment? Everybody is nowadays, they come after consulting the Google. Everybody goes through the Google first, then they come to us. So counseling is very much required. So we counsel accordingly. Whether you plan pregnancy and you want to prolong for a year or two, accordingly we manage the case. For example, if small fibroid is there, but it is in the cavity, intrauterine fibroid cavity, it's a submucous type. So whatever medicine we suggest, already she is suffering with the heavy flow, heavy bleeding. So in such cases, usually we advise surgical management. But in cases of intramural fibroid, where it's not going to give much problems, only pain and bleeding is there, so we advise non-hormonal treatment. So counseling is very much required. It's a very good drug, or I have tried in so many patients. Initially, I wrote it for 3 to 6 months, but more than 6 months or a year or two, patients they have continued, and they are really relieved of heavy flow as well as pain during periods, because bleeding is less as well as pain is quite less. Sometimes it causes amenorrhea also. So once amenorrhea is there, so naturally patient does not feel any pain or bleeding. Naturally, those who have completed their family, in cases of infertility where immediately pregnancy is required, I don't go for the hormonal treatment. Or as well as if they already they have completed their family, but not at the age, usually at the age of 35-40, if they are having small fibroids, and they are having problems of menorrhagia as well as dysmenorrhea, pain during periods. In such cases also, I prefer to write non-hormonal treatment is the first choice, because it's not going to give side effects, and if patient is comfortable and is relieved of taking this medicine, so there is no need of giving hormonal treatment. But provided fibroids are very big in size, then I don't advise much. But when multiple small fibroids are there, 3 centimeter, 2 centimeter, and cumulative size is about 5-6 centimeter, I continue with the non-hormonal treatment, and it gives a good result. Patient is relieved of symptoms, and if after 6 months I advise them to go for the repeat scan, the size of fibroid is reduced. But not in case of sub-serous fibroid, because in cases of sub-serous fibroid, no drug is effective, and moreover that sub-serous small fibroid, they are asymptomatic. They don't, such type of patient, they don't require any treatment. Only cases of intramural, cases where pregnancy they are waiting for, and if they have already completed their families, in cases of perimenopause. Results are good, and they are relieved of pain as well as relieved of excessive bleeding, because they come to us only with the 2 complaints, short cycles and excessive bleeding and pain during periods. All they are relieved by this medicine, and it's a really wonderful medicine. I liked it. That does not, because as we know, hormonal treatment, if we advise, we have to advise them repeatedly, monthly liver function test and other profiles, because once we write it any hormone treatment, we have to counsel about the side effects, and later on regularly investigation in regular interval. So in such cases, if we write non-hormonal, usually they don't require any investigation in between. They can come for the checkup after 3 months, and if they require, because patient is only considered about the size of the fibroid. If even we counsel them, sometimes they are relieved of symptoms, but size is not that much decreased. So even then we counsel them, because size is not decreased, no problem. Your symptoms are relieved, it's better to continue the medicine. At least this problem will be over. Yes, I write it and I'll continue to it.